Good afternoon, buenas tardes, and welcome to another episode of Community and COVID-19 Lunch and Learn. I'm Fernando Valenzuela.
And my name is Janelle Patiences. We are from the Hispanic Health Council, and we go out to the community to educate people on everything they need to know about COVID-19. So if you have any questions, please submit it in the chat below, and we'll get to it at the end of the video, which will have our Q&A.
Today's topic is going to be COVID-19 and LGBTQ plus mental health with our guest speaker, Dr. Gio Iacono. Dr. Iacono is an assistant professor in the School of Social Work. His areas of practice and research specialization are LGBTQ plus youth mental health, youth resilience, promoting diversity and inclusion within social work education, and mindfulness-based treatment approaches. He primarily focuses on intervention and community-based participatory research. Dr. Iacono has worked as a psychotherapist, clinical social worker, educator, community organizer, and researcher in a variety of health and community-based settings. His community development work has been focused on promoting the mental and sexual health of diverse and marginalized communities. Gio has also been a mindfulness meditation practitioner for many years and integrates mindfulness in his work as an educator, researcher, and clinician. Gio, thank you so much for joining us today.
Thank you for having me. It's a pleasure to be here.
Is there anything else you'd like to add about your background and current work?
I'm excited to get into the conversation, and it's great that a lot of the experiences that I've had as a clinician, as a therapist, and as an educator and researcher informs a lot of how we approach kind of building programs and supports and mental health services for vulnerable LGBTQ populations. So it's great to be here and to dive into this stuff, definitely.
Perfect. We're excited to have you. So like you said, let's just jump into the questions. So the first question, what is mental health? Your work focuses on LGBTQ plus youth mental health. Why is it important to make the distinction and not focus on mental health broadly?
Yeah, I mean that's a great question, and I think it is helpful to look at mental health more broadly and seeing that as an important part of our well-being, as part of living a good life. And in some ways, you can say mental health is part of our overall health. And so I see mental health as really looking at like our emotional, psychological, and social wellness and well-being. So thinking about how we feel and act in on a day-to-day basis. What are we thinking? Our thoughts, are they more painful or negative, or how are we doing with stress and making choices that are helpful for us? And so there's a lot that goes into mental health, and I think it's important at every stage of life. So thinking from when you're a young person, a childhood, through adolescence, but also as you move into like middle and late adulthood. So various stages of life have important um, things to consider when we're talking about our feeling good and our mental health more broadly. But I also think there's other factors that we have to have to consider when we're talking about mental health. So it's life experiences like trauma or abuse, or sort of social problems like racism, poverty, homophobia, and there's also biological or family history and kind of things around genes or brain chemistry. So there's a lot of different factors, and so I think it's important to look at mental health more broadly, but also considering what we know in terms of vulnerable communities like LGBTQ youth or LGBTQ populations. I think it's important to make that distinction because of and what we've seen in recent years in terms of the documented health disparities. So we know from recent research that LGBTQ individuals, so lesbian, gay, bisexual, transgender, and the acronym has been evolving over the last several years, and so when we think about the kind of basically sort of the sexual minority, gender minority, and we can get into that a little bit uh, in a bit, but basically looking at the disparities there in terms of what we've seen recently, they're twice as likely to experience mental health problems compared to straight or heterosexual individuals, and then youth are like 4 times more likely to experience mental health problems, attempted suicide, compared to their non-LGBTQ peers. And so it's very significant disparities. And when you add an intersectional perspective, LGBTQ youth of color particularly Black and Latinx youth experience even greater disparities. So it's important to make that distinction, not only in understanding our kind of how we sort of aim to advance knowledge and build knowledge in terms of research and finding out what these issues are, but also in terms of the implications for programs and services in the community that will help these vulnerable communities.
All right. Thank you for that. Next question. What are some mainstream perspectives of mental health that you've seen? How do these affect the way we can support mental health, both individual and at the systemic levels?
Yeah, it's a it's a big question. It's an important question because I think as we continue to move through the COVID-19 pandemic, we are seeing perceptions shift, for better, for worse, perhaps. But we do know that some kind of broad perceptions prevent people from seeking mental health support. So mental health support can be, talking to a counselor, a therapist, or a social worker, talking to your doctor about how you're feeling, if you're feeling depressed or if you're feeling anxious or fearful, and just even if you're feeling overwhelmed and stressed out, those are important conversations to have. But many people might not talk to their mental health providers or to their doctors or even to their family and friends because of the fear of being sort of seen as abnormal or seen as like crazy or lack of effort or lazy and move on or just think differently or there's always a response, I think, in society that we just need to kind of do better and so I think those perceptions are shifting, so we're seeing some improvements in how we're understanding mental health. Even within the media there's more awareness, um, and especially when we're looking at the mental health issues that have come out of COVID-19. um, I think that's an important piece, that people are finally at this place where uh, we realize that the impact, the social factors, and things that are going on around in our world and society have an impact on our mood, our anxiety, our stress levels. So it's really important that perceptions are shifting. I have some stats here in that, like in the recent poll, I think it was a 2020 poll, um, what we've seen is that 87% of American adults agreed that having a mental health problem is nothing to be ashamed of. So that's quite a high number of the population. And then there's a high level of kind of understanding that someone with a mental health problem um, should get the support that they need. And so that is important to consider. So perceptions are shifting, but I still think there's a lot of work to do in terms of destigmatizing mental health and mental health problems generally.
All right, all good information. Another question. Have How have some of the negative consequences of COVID-19 pandemic, such as loss of jobs, inflation, eviction, affected mental health? Are there any differences in the ways that mental health has impacted LGBTQ plus folks or other marginalized groups because of this?
Yeah, definitely some negative consequences that have contributed to a lot of mental health problems or symptoms. Um, so some of those are isolation or even stigmatization from being isolated and social distancing. So there is a lot of exacerbation of mental health problems, feeling more stressed or more depressed or anxious because of the isolation due to the pandemic. And also the closure of many institutions, educational settings, workplaces, entertainment venues, just kind of general community spaces have been limited, restricted over the last couple of years or so. And so there are a lot of stress that comes out of that, and people needing to stay home, and so that has an impact on their social, mental health, and then also I know that we've seen sort of very common symptoms around like depression or worries, uncertainties about the future, even physiological kind of symptoms like headaches and pain throughout the bodies, changes in eating habits. So all these have been documented since the beginning of the pandemic in March 2020. Unfortunately, even COVID-19 has brought on exacerbated rates of domestic violence and abuse at home, particularly among women. So that just all calls for the need for greater supports and services to support assessment of domestic violence and these other kind of issues in the healthcare settings or mental health care settings, as well as also just being able to kind of build more supports as it relates to the COVID-19 pandemic. In terms of LGBTQ communities, I know that a 2021 study found that more than 80% of LGBTQ youth have reported that COVID-19 had increased their stress. And sadly, only 1 in 3 youth found their home to be safe and affirming as an LGBTQ young person. And so these are very, very stark kind of issues and consequences of the COVID-19 pandemic. And so there's also other very real problems like losing jobs and unable to kind of be able to deal with certain emotional challenges. So lots of issues generally, but also for the LGBTQ population and young folks in particular.
Gio, we talked a little bit about the kind of perception of mental health. Can you talk a little bit more about the trends you've seen in LGBTQ plus mental health before the pandemic, and maybe any ways that they've changed since then?
Yeah, absolutely. So I know, I mean, it's working in the kind of mental health world, and in particular in psychotherapy counseling settings. It's clear even before the pandemic that LGBTQ populations, older adults, young adults, youth, are underserved in healthcare and mental health care settings. So, for whatever reason, there are potentially some very real reasons not to access healthcare, maybe fear of being discriminated, not having gender affirming care in terms of sort of specific needs that trans communities might have for around health and mental health. We also know that in terms of other significant issues in healthcare, mental health care related to racism and discrimination around class, and so all these factors kind of intersect and exacerbate the issue. So that's been a big problem even before the pandemic. Also, significant homelessness for LGBTQ youth specifically, so they are overrepresented in the youth homelessness population. And so I think with the COVID-19 sort of era, this situation has really kind of compelled us as practitioners, as researchers, to pivot and continue to provide supports as for in whatever way we can, doing that virtually or doing that in very sort of unconventional ways. And so we've been able to adapt, but I think there is a lot of kind of need at this point, given that the mental health system is overwhelmed and they've already been underserved to begin with. And not to mention the very real legal and political sort of challenges that are impacting the mental health of LGBTQ youth when we're thinking about places like Texas and Florida, advancing directives and bills that basically create barriers for care for LGBTQ youth, particularly trans youth, and not being able to speak and actually learn about ways to be supported as an LGBTQ young person. So these are very real impacts and create an atmosphere of fear that is inherently traumatic. So this is the ongoing kind of context that we'll have to be working in to be able to improve mental health. So it's going to require a lot of different things, from legal, systemic, institutional changes to very real sort of changes in practice and counseling and what have you.
Yeah, there's a lot going on in the world that's
Yeah.
affecting our mental health.
For sure.
So when it comes to access to services and resources, I know you mentioned that the LGBTQ plus community has been kind of underserved and the systems right now are overwhelmed. Can you talk a little bit more about what the resources are going through because of the pandemic right now?
Yeah. So I mean, I was mentioning earlier that there has, I mean, in many ways, it appears that there's decreased stigma in terms of accessing or receiving services. While at the same time, there's the reality is that our mental health system, our healthcare system generally had been or has been overly taxed. And I can say currently working in Connecticut with clinicians, mental health providers, we are seeing that they are very much overwhelmed, and the system is not responding as quickly to be able to provide the services and supports that young people need, or that generally people need. And so the other part is that there's also a significant proportion of young people or people in general actually that lack access to affordable mental health and healthcare coverage. And so that continues to persist in the pandemic. And I think also that the other piece is there are barriers to accessing services, whether it's telehealth or in person, just because of the lack of trust within the in the of the healthcare system, the mental health care system, among vulnerable and marginalized communities or traditionally marginalized communities. The other part I think is also that while telehealth has made services more accessible, perhaps, um, I think there are many parts of the country that don't have access for whether it is in terms of financial reasons or also just access in terms of their location. They might be more rural or remote communities and unable to access telehealth care. Um, and so there's those really real logistical issues, and then there's also the fatigue experienced by providers. So it does impact quality of care overall. So there's definitely a lot of trying to kind of be creative and be able to sort of find ways to expand these services, but there's always resistance to mental health care and mental health access and services. So that's something that will continue to be experienced. Yeah.
I had a follow-up now that we're talking about access. What does it look like in the LGBTQ plus community to have like health insurance? And when we're talking about access to mental health, how much of it is covered by health insurance? I'm just thinking about the cost of seeing a therapist, even with insurance, can be pretty costly.
Yeah, yeah. And if there are um, youth or young people that have access to health insurance through their caregivers, their family, that might be something that could be helpful. And depending on the location, the region that you're in, you might see less of that. I know for sure, my experience working in the city, most of the youth that we saw were either homeless or underhoused, so they were like couch surfing or like kind of transition. And so the reliance on free, low barrier, affordable services really was the way that they received help and support. And so that's going to be my advocacy piece for forever, probably, in terms of making mental health programs and support um, low cost, free, and low barrier. Because a lot of times there's criteria and requirements to be able to enter and receive those services and support. So those are the other things in that, like, if there are programs, supports, agencies in the state that allow for um, low cost or free access, then that is probably the best route to take for young folks. The other issue, though, there is that we don't know to what extent those programs are affirming LGBTQ affirming. So that would be a good question to ask if you're a young person and saying, what is your what kind of supports or what approach do you take for LGBTQ people? You might ask if you're accessing those supports, or if you're talking to your doctor, a doctor may be able to kind of inquire, investigate whether these supports are affirming, because that is a big important factor
Mhm.
in terms of whether these supports are actually helpful for young LGBTQ folks.
Um, I think you touched on it already, but are there any age groups whose mental health has been more negatively impacted by COVID-19? And how did this impact the LGBTQ plus community and their mental health specifically?
Yeah, I think what we've seen a lot, and this is data from perhaps the last year or so, is that we've seen young adults experiencing a significant number of pandemic related kind of issues and consequences. as I was saying earlier, like closures to schools and loss of income, loss of jobs can contribute to poor mental health. And so I think when we look at kind of the span of the pandemic so far, we look that there's an average, so larger than average share of young adults that are actually experiencing elevated anxiety, depression. This one study reported 56, so over half of the sample of youth that reported the anxiety and depression, and as well as a greater likelihood to report substance misuse or alcohol, drugs misuse, and so there was and suicidal thoughts as well. So that the young adult population in particular are high risk for poor mental health. Also, we're also seeing with related is concerns for parents or particularly mothers experiencing challenges with school closures and lack of childcare. So that extra burden or that burden on top of already what they are doing creates extra stress and anxiety. And so what we're seeing is women, particularly women of color, with children, are more likely to report anxiety, depression compared to men. And that's been probably an ongoing sort of challenge prior to the pandemic, but I think it's exacerbated throughout the pandemic period. And in terms of the LGBTQ community and their mental health, I think those pieces, if we like to take an intersectionality perspective on understanding some of these challenges, and that, if we look at LGBTQ experience of being gay, bisexual, being transgender, and then combining that with the experience of marginalization as being a woman, or being a person of color, or being a newcomer to the country. So all these different points of marginalization or challenge or stress can intersect and interact. And so we see that does have an elevated level of mental health challenges and health challenges more broadly for LGBTQ folks that experience very interlocking forms of stress and discrimination.
All right, so I know Fernando has mentioned this, and you have a lot of experience. So you have a lot of experience as a clinical social worker, a psychotherapist, an educator, as well as other roles. Do these roles change the way that you approach mental health? What have you learned about mental health from working in each of these roles?
Yeah. Yeah, I think so. I feel fortunate to have had many years working in mental health, in social work in particular, and so the clinical practice experience really connects to the research work that I'm doing, and I could talk a bit more about that as well. But basically, the lot of the research that I'm doing, that mental health research for LGBTQ youth, is informed by my years of being a therapist and doing social work practice. So that informs how I might shape and help develop programs for LGBTQ youth, and also how those programs and that research informs what we teach and what we talk about in the classroom when we're working with students, the next generation of mental health providers, clinicians, social workers. And so that helps us sort of teach to what we're seeing as the best practices, the most helpful ways to support LGBTQ population. So there's a lot of talk about affirmative practice, so LGBTQ affirming practice, so whereas the opposite of that is really literally like denying and trying to convert people to become straight or cisgender. And so that we know is extremely harmful and goes against the medical, psychiatric, and social work sort of professions, values, and ethics. And so that piece is, I think, I see it as a continuum to be more affirming. And so, how do we teach social work students, mental health clinicians, counseling, psychology students to be more affirming when working with LGBTQ folks? And so the combination of my experience in seeing the lack of affirming services, plus trying to develop more affirming services, and then teaching to those results or those findings of what actually works, I think it creates a stronger approach to building better supports for LGBTQ communities. I've also learned, despite all the challenges we've had in the pandemic, um, I think we as mental health providers are still able to be present and be helpful to people, even if we're doing treatment and support virtually or through telehealth. So I think we talk a lot about therapeutic relationship in our work as mental health providers, so that the importance of having this relationship to be able to kind of trust and be able to talk about stuff and process difficulties and traumas. And so what we've seen, because we've been compelled to move into the virtual world and telehealth services, I think we've been able to demonstrate through our research, particularly with LGBTQ youth and young adults, that there is still a quality sort of opportunity and relationship that can be cultivated even virtually. So that's promising, given that we might be doing a lot more virtual work over the next coming years. So, and I know there's been resistance in our field, in the mental health world more broadly, towards virtual services. So I think the pandemic has really kind of helped us shift and see that it's very much possible to do this good work. So I think all these experiences in practicing online, and then teaching and research really helps us create a more sort of helpful process or better approaches to supporting LGBTQ populations.
That was a great answer to that response. Thank you for all your work you've done, first of all, because you have a lot of experience. So how does resilience tie into the work that you've done?
Yeah. Yeah, so resilience is an important part of my approach. And I, when I think about resilience or how I define resilience, I see it as prevailing or overcoming the stressors, the challenges, the difficulties in life, and being able to kind of thrive uh, despite all the difficulties that one is experiencing. And that's hard to do. I think resilience is such an important, and I think relatedly, a sense of hope is very hard to come by right now, considering everything that's happening in our world, and just, I mean, there's so much fear and anxiety and uncertainty that many of us are experiencing right now. And so resilience, I think, is something that we try to intentionally incorporate into the work that we're doing to build better supports and services for LGBTQ folks, but also more generally, general populations. And so for me, what in our programs and the services that we've kind of developed over time, I think what we've been able to do is measure resilience and seeing, you know, do these supports, do these programs help build resilience? That's one of the questions that we like to ask. And so we have seen improvements in resilience by having LGBTQ youth, for example, participate in like an 8-week program that really addresses their specific needs and helps them sort of develop skills and strategies to cope with certain life stressors and make changes in their world. And so we looked at things like stress appraisal, for example. So how do I describe this? So stress appraisal, when you see something that, a challenge, let's say, do you see it as uh, threatening, or do you see it as an opportunity, or somewhere in between? I mean, there's different ways that we might appraise stress. So when you start to experience stress, what is your cognitive understanding of it? And so we try to move youth through to see uh, stress less of a threat and more of something that is perhaps the experience of of being in a very difficult society, and understanding that that they might have the coping strategies and resources to be able to address some of those stressors. And so and that involves social supports, that involves dealing with discrimination and bullying, and there's a whole lot that I can get into. But so resilience is really about that, like I can do this, I can be in this world, and there's a sense of hope almost.
All right, perfect. Thank you. Can you talk about mindfulness-based treatments approaches and how it relates to mental health?
Yeah. Um, So let's see. So maybe I'll give a definition of mindfulness just for listeners or viewers that are not too familiar with it. So mindfulness, I use a simple definition from Gina Beagle, and it's noticing your thoughts, feelings, and physical sensations in the present moment without harmful judgment. So you're being aware of what you're thinking, what you're feeling, what's happening in the body, in the present, without being judgmental of it. So like pushing it away and saying, "Oh, I shouldn't be feeling like this," or it's bad that I'm feeling stress and all that. So it's just there's no judgment. It's more of a kind approach. So that's how I see mindfulness, or how that is an important quality to have, or an attitude to develop. Um, and so I think that works to help us cope with the stress that we've been talking about. So imagine there's such a lack of compassion in our society for LGBTQ folks, for folks that are experiencing discrimination. And when we think of like the ways that even in particular when we look at intersectional experiences, so a lot of the youth that I work with that are Latinx or Latino, they tell me that a lot about the extra double level of stress in terms of being fearful of anti-immigration kind of sentiment and discrimination, as well as being gay or being transgender, and the racism that they experience and that their families experience. So all these kind of pieces combine to create an extra level of stress. And so mindfulness is really just acknowledging that that is happening and bringing a more kind attitude towards yourself for experiencing such suffering and discrimination in our world. And so it's not a passive thing. It's more like it helps us sort of cope with stress, which will then potentially help us improve and change things for the better, whether that's seeking help or doing advocacy work or whatever it might be. So yeah, and so there's treatments, there's approaches within the mindfulness kind of literature that are known to help improve depression, anxiety, and stress more generally. And so these emphasize our internal experience. So you practice exercises like observing emotions, observing sensations in the body, practicing to be with certain thoughts and feelings and unwanted experiences. And I think that's a process. You build that over time, and you build a sense of exposure to these difficulties. And what happens is that a lot of times we adapt to those things, and it helps us sort of be more with them so they don't overwhelm us or overtake us. And so then from there, if we are feeling more grounded, more calm, we might be able to do more things in our world that can help improve it, whether it's in our own personal lives or more broadly in society. So that's kind of our approach that we take. And so it's a psychological resource, as I see it, to managing and coping with difficulty, especially if you experience trauma. And if you've experienced trauma, and there is a need to sort of process, address that, because a lot of times it can keep us stuck. It can keep us in a place of fear or unable to kind of live a good quality of life. So mindfulness can be a tool to help us to sort of process that trauma as well. So there's a whole lot I can say about that in terms of how we approach mindfulness-based treatments, but in essence, we're developing skills and practices to help us be more resilient in the face of discrimination, trauma, and our own kind of self-criticism and internal negative thoughts and what have you. Yeah, I could say more about that if that's.
Well, it's really interesting concept thinking about mindfulness and resilience as being kind of like, I'm seeing it as like a way of reframing situations internally. And I'm wondering if maybe you can give an example. I'm trying to think of like what it would look like if I'm trying to take these approaches. What kind of exercises would you tell me to go through? Like, is it like every day kind of thing, or?
Yeah, I think it depends on the individual a lot of times. So there was a traditional kind of old school way of doing mindfulness where, you learn a practice, so you notice your breath. Let's say you continually put focus on your breath. So you're silent, you're noticing your breath, and the prescription was really to do it on a daily basis for like 40 minutes or something like that. And so while that is wonderful and potentially helpful to build the skills of concentration and awareness, um, the reality is that many of us don't have that time or that ability to just be able to kind of sit there and do that. And especially when we think about younger people, um, a lot of times, we need to do shorter practices, 5, 10 minutes. So really, I say that the more the better, and really even 1 minute counts, 1 minute a day, and just kind of taking a few deep breaths, um, just paying attention to what you're hearing, what you're feeling, what you're kind of tasting or smelling. Like it could be just tapping into the senses and deep breathing to bring more awareness of your surroundings. And so that's something that it can be learned through various activities, and there's a lot of available free apps and resources online that I've put in a document that actually can share with the audience. But there's a lot of resources out there, and ones that are specifically for LGBTQ or BIPOC folks, Black, Indigenous, people of color, and LGBTQ BIPOC. So like the intersections of different identities. So there's a lot of resources that can be culturally responsive to our needs as people that need supports and mindfulness kind of approaches to help them manage stress better. So I recommend, if anything, just even as much as possible, even if it's a few days a week, just to do a couple minutes of mindful breathing or mindfulness of sounds, where you just sit silently for a minute or two and listen to sounds. And it might not seem like a lot, but there is a lot of research that's supporting how these practices, even small doses, can be really helpful in terms of being more present in our lives and showing up in our lives and having greater relationships and coping with stress and being less sort of overwhelmed and kind of hyper vigilant or checking out. So there's a lot of benefits, but of course it is something that you have to experience. And so I really encourage our audience to get up and try some of those things, the free resources if possible as well.
Now, all that makes me think of, I remember reading a while ago, like a lot of teachers were incorporating yoga classes and meditation into their curriculum, especially with youth. Do you see this as being helpful in that regard?
Yeah, I think so. A couple things there. So I know that even as someone who is, born in the West, born in North America, and aware of the practices that are available to us from the yoga tradition, from the mindfulness tradition, and I think those are helpful and can be helpful. But I think it's also important to acknowledge the roots and the traditions that those come from, the indigenous traditions within South Asia, Southeast Asia, and Buddhist traditions, for example. And so acknowledgement, I think, is an important piece. And I think that is something that we want to try to stay as close to in terms of the practices and the ways that those those uh, those exercises or practices have been sort of taught and explained. And so I think it's important that if we do incorporate that into various systems, a school system or in healthcare, I think it's important to have an acknowledgement of that, despite what might be resistance from many in terms of resistance related to like interfering with their religious beliefs and what have you. But I think with mindfulness and yoga traditions, I think that I see them as very compatible to various spiritual practices and traditions, whether you're Christian, Buddhist, Muslim, and what have you. So I think it has been helpful. And we've seen a lot of research that supports the efficacy or the effectiveness of these kinds of programs in schools to help youth with attention, concentration, even school age, like kind of pre-K, like thinking preschool, young folks, and even to older adults. So there's definitely benefit across the lifespan in terms of using these kinds of programs and activities for sure.
Gio, I wanted to move into like a more individual and personal level. So can you tell us what some signs are that a person is going through a mental health problem, and what are some things that we can do to help them?
Yeah. So I think going back to mindfulness as a tool or as a skill to help us become more aware and present, I think that can help us in recognizing some of those signs or symptoms, or however we might describe it, some of those ways that we know that we're not feeling good. So some of the more traditional ways of understanding that is looking at changes in our behavior and our thinking. So maybe we might be staying isolated more, we might be staying inside more. I mean, even apart from the pandemic, like we just might not be willing to interact with people as much. Or in terms of thinking, we might have a harder time concentrating or be able to focus, or we might have an onslaught of very sort of unhelpful thoughts, like in terms of your own self-worth, like I'm no good, I'm a bad person, I can't do anything right. So there might be an increase in those kinds of negative thoughts that have an effect on us. We might lose energy or motivation to do things. So maybe you were able to, for example, get up on the weekend and go outside and play with your kids. You go to a park or something like that, and you've just lost all motivation to do that and just disengaging. So behaviors and thinking, you might be talking more about not wanting to be alive, or about death and dying, and increased like anxiety around that. So there's a lot of different things that you might look out for, but ultimately you're starting to notice that life is really has become a lot worse, or has been chronically that way for a long time. So those are all important signs to recognize, and then what do you do with that, right? I think a lot of times we end up just internalizing them and having that level of pain and suffering without getting the needed supports. And so um, as as difficult as this might be, I start by saying reaching out for support. So there's a lot of shame, there's a lot of resistance to going to get support. But I think that is one of the first important steps that can be helpful. And support can mean talking to your partner, talking to your a trusted person in the family, or it could be reaching out to your doctor, or to, and if you do see a mental health provider, letting them know that I'm not feeling well, things are getting worse, and so having those conversations, trusted people in your life. And I think the other piece there is there are resources available in the community, and in Connecticut in particular, there's like national suicide prevention hotline that's available across the country, but then there's a specific numbers that you can call or even text in Connecticut, and some that are specific for LGBTQ folks and trans folks in particular, who might not have a lot of trust or hope for support in the general healthcare and medical system. So we also have these things, these lines that are helpful if you're not necessarily in crisis, like you're not necessarily suicidal or you want to end your life, but you have a lot of stress and anxiety, and we call those warm lines. And so there's trained volunteers that offer support and resources that you might be able to use in the community. So there's different resources, and I have that document that you can access, hopefully, with those specific numbers and supports. So that would be maybe one of the first kind of steps to take to be able to kind of support and start to get the help that's needed. Um, I also just want to say, in terms of like, so there are signs and symptoms that you might look out for. The other thing that is important is prevention as well. So the best way to handle a crisis really is to prevent it in its first place. So what are the things that we might do to take care of ourselves that might reduce or mitigate the kind of level of risk of going into a mental health crisis, like being suicidal or wanting to end your life? And so going back to mindfulness, I think it's awareness of how you're feeling, whether you're feeling overwhelmed, sad, or anxious, and figuring out what you might need in that moment. So sometimes we talk about stress management or problem solving approaches that can be helpful. Working with your family, working with people that you trust to be able to kind of address some of these issues in one's life. And then there's very kind of sort of general or prescriptions around, like sort of doing the best around sort of eating, sleeping, and getting enough of the kind of things that you need to have a good quality of life. These things are hard when we try to when we think about the ways that social systemic barriers prevent us from experiencing a good quality of life. So while we try to improve things in our sort of immediate situation, there are other factors like discrimination in the workplace, or hiring practices that are racist and that are keep or homophobic or transphobic, that keep people from accessing good quality sort of resources and financial resources to have a better mental health. So those are the other things that we're trying to, as a social worker, as an educator, to get involved in and advocate towards improving policies and practices that are more fair, equitable, and socially just.
Thank you for all that information.
There's a lot more there, of course.
Yeah.
Inexhaustible. Yeah.
Yeah, and I mean, I think all that is really good to know, especially, during these times. It's important to be able to recognize if maybe somebody's going through a problem and to reach out. So I have a kind of big question for you. What are some changes you'd make to our systems and institutions that would allow us to better address mental health? It doesn't necessarily have to be like pragmatic. I'm just curious to hear general thoughts.
Yeah. I mean, I have big hopes and dreams around improving our systems and institutions to improve our mental health. I mean, maybe I could start with the healthcare system, and I think right there, that to me, that I see a lot of gaps and sort of a lot of issues that basically cause or lead to people falling through the cracks, if you will. So meaning they might get missed, certain things might get missed, certain diagnoses might not be made that could allow them to move into treatment. So there's a lot of issues within our healthcare system more broadly in terms of sort of being disintegrated. So there's not enough sort of connection or integration of different types of services. So when we think about mental health care, a lot of times it's very disconnected from primary health care, or when we think about the ways that our services, mental health services even, are developed, a lot of times they are not inclusive of the communities that they are serving, or that are accessing these services. So to me, the more integrated care as well as more culturally responsive care are important. So having services more one-stop shopping, where you have all the different kind of types of health and mental health supports, whether that is looking at nursing care, whether that is prenatal, that is mental health, and so having those pieces, or rehabilitation, physical therapy, all those more integrated into a system, and then having more culturally responsive services. So that might be providers, practitioners that are representative of the communities that they serve. So thinking of communities of color or LGBTQ communities, and having providers that actually reflect the identities of the community. So that means in terms of mental health and health education, getting more LGBTQ folks or people of color in nursing, medicine, social work, counseling, so more representation. And I think that representation can help inform ways to make our services more inclusive and better in terms of health and mental health. I will say for sure, more broadly, and as a Canadian, I strongly advocate for universal healthcare. Healthcare reform is the biggest thing, and I know that there's been efforts in recent years, particularly in the ways that Obama was able to sort of advance a lot of the Affordable Care Act pieces. But I think that's going to be another big struggle that we're going to have to be working towards in terms of advocacy and changing systems and institutions. So broadly, universal health and mental health care would be the ideal, the kind of ways that would help significantly diminish or reduce disparities for disadvantaged groups. And then as well, addressing issues around resources and investments and funding to lower income neighborhoods and communities, income supports. I think all these things are contributing to our mental health, or the lack of those resources can negatively impact our mental health. So those pieces are obviously kind of, well, they may not be like mental health specific in terms of like the kind of the health sort of framework or lens that we use to understand mental health. All these pieces interact and can help improve our mental health. So those are the bigger pieces that are intergenerational, longer term advocacy work to change. But we want to continue doing those good things.
Lots of work to do.
Mhm.
Yeah.
So you shared some resources with us earlier. I know we had that first page up. I don't know if you have anything more you want to say about that in particular, or if you want to talk about the other participation events that you have.
Yeah, I will say with this document here, I've added some of the Connecticut local specific mental health resources and supports, and like basically um, numbers that you can call or text that will allow you to reach out to someone to talk about some of the problems that you're having. And it's all private, it's all confidential. Um, I know that there are other resources that are more specific for, let's say, communities of color or LGBTQ communities. I've added some of those pieces, some links in there that are specifically geared to BIPOC or LGBTQ communities. I also, being of a mindfulness background, I added some resources there that are mindfulness for LGBTQ folks, mindfulness for BIPOC folks, as well as more social justice oriented mindfulness practices. I think mindfulness has been critiqued as like, not being acontextual and not taking into account the real socio-political problems in our world that impact our well-being. So I've added some of those mindfulness social justice resources and access or links to free apps that you can download to do mindfulness practices, and as well as LGBTQ supports organizations, agencies in the state of Connecticut that you can reach out to in your region. So yeah, so that's the kind of resource document there.
And we will share that on our Facebook page after this.
Wonderful. Okay, great. And I think there is also another piece there. I think the flyers. Yes. So, at being in the School of Social Work at the University of Connecticut, we are doing basically we've launched an 8-week program that's mindfulness based for LGBTQ youth and young adults. So the age range is from 16 to 29. So if you're between 16 and 29 and want to participate in an online 8-week group with trained mental health clinicians and with a curriculum that helps you learn the skills of mindfulness and also ways that you might be able to address some of the stressors in our lives. So we talk about discrimination. We talk about ways that we can address discrimination in our personal lives and more collectively in society. Ways to address bullying and violence. So there's a bunch of different culturally specific pieces for LGBTQ folks. And the one thing that I really want to emphasize is we use an intersectional sort of framework or perspective to be able to talk about some of these challenges. So when we're talking about homophobia, that's not the only thing we're talking about. We're talking about racism. We're talking about xenophobia. We're talking about sexism intersecting with homophobia, for example. So it's a very comprehensive program, and it is a research study, so you can get paid up to $130 for participating. So it is low barrier, free mental health support. Plus, you get paid for doing some of the surveys because we are looking to evaluate it to see its effectiveness over time. So yeah, there's a group on Monday starting May 2nd from 6 to 8. And I think that's for 16 to 22-year-olds. And then there's a group on Friday starting April 29th, 6 to 8. And I think that's for older young adult folks. So there are flyers, and you can use the QR code, or you could email me, of course, and I can get you set up with getting enrolled into the program. So if you're interested, do let us know. We'd love to have you.
Yeah, we'll definitely be sure to share that as well, along with your contact information.
Wonderful. Thank you.
And so, Gio, that was the end of our questions. Did you have any final thoughts?
I mean, ultimately, I love what you all are doing. Fantastic work, and I think to me, there's a hope that we can sort of build more services and supports in Connecticut and more broadly across the country to support LGBTQ young people from all walks of life, all ethno-racial backgrounds, identities, and whether that is something that is done online or offline. I think that's we want to build that so we have a greater, a more strong framework or system to support young people, and particularly young people experiencing discrimination and marginalization. So the hope is that we can do that in a more community-based way. So even as we've been talking prior to our interview, the kind of the collaborations in the community with different agencies. So that's really my hope in terms of reaching out to different communities or different agencies, organizations that serve young people in Connecticut, and be able to build some of these programs and supports to help improve their mental health. So I'm open to more discussion and collaborations going forward. So.
Yeah, we'll definitely be keeping in touch, and hopefully can continue collaborating.
Yeah, great.
So for sure, Gio, thank you so much for being a part of our webinar. We really appreciate you and your experience and everything, to be honest. So thank you for everything.
Thank you. It's a pleasure. Appreciate that.
Thank you so much. Take care. Have a good Wednesday, and hopefully we'll talk soon.
Thank you. Likewise.
Thank you, Gio. Well, everybody, thank you so much for joining us today. Stay tuned for future webinars and stay up to date with all future events and Hispanic Health Council stuff on our Facebook page.
Thank you. Bye. Happy Wednesday.